We are reading you today from, I'm in Chicago, Illinois, and Kelly Pareles is in Pennsylvania, and Susan Barrett is in Richmond, Virginia. And we welcome you, and we appreciate the opportunity to share with you today a quick webinar on integrating mental health through PBIS systems in schools, and we refer to it as the Interconnected Systems Framework, or ISF. And I'm going to do the front end, and then Kelly and Susan will do the rest of it. And to show you who we all are, myself and Susan and Kelly are part of what we call our ISF National Leadership Team. We're the kind of the worker bees. And Susan and I and Kelly are all part of the National PBIS Technical Assistance Center, funded to lead this work on mental health integration. And we have partners from the Center for School Mental Health listed on our team here, as well as other partners from the National PBIS Technical Assistance Center. And you may be familiar with the monograph that Susan, myself, and Mark Weiss edited, and has a lot of people contributing to it. And it came out, gosh, I hope I have the year right, Kelly. I'm going to say October of 2013. And we worked with a lot of different players to put the monograph together. And just a quick comment about the monograph, we like to refer to it as a field-based intervention. And as you can see by what's on the screen up here, samples of some of the chapters, they were all co-authored by one person from the National PBIS TA Center and one person affiliated with the National Center for School Mental Health. And the reason I like to refer to it as a field-based intervention is, to be quite honest with you, George Sugai and Sharon Stephen didn't really know each other before we threw them together to co-author this chapter. They knew of each other, but they hadn't met. The same with Nancy Lieber from the center and Bob from the Mental Health Center and Bob Putnam from the PBIS Center. So we not only paired people from the two centers, but we brought in a group of practitioners from the field. Kelly Pareles was one of them, who are actively doing the integration work, and our goal was to bring people together to learn what they had been struggling with, what they'd had success with, and to try to organize a foundation, a model approach for them. A lot of other people have contributed not only to this monograph, but the work that we have done along the way, so we just wanted to start with all the acknowledgments. We're not sure how many of you have had an opportunity to review the monograph. I don't know that we have a way, Mike, on this GoToMeeting for people to either raise their hand or indicate, but what we want to know is if you already have questions or observations, to go ahead and put them in the chat room now. If there's something you read or you heard about this that already raises a question for you, don't wait, put it in the chat box now. Full disclosure, I cannot see the chat box because of our technical glitch. We're doing a workaround. But Kelly and Susan can see the chat box, and they know how to interrupt me and cut me off if it's a good time to raise a question. But I don't know if we have any startup comments in there, but we will keep an eye on it as we go along through our content. So the content for this afternoon's webinar: how can we install effective systems for mental health support for all youth through schools? And we also will give a little bit of the history and rationale and structure, and then share examples. And you'll notice, I'm thinking many of you are familiar with Implementation Science, Dean Fixon et al., Exploring, Adopting, Installing, Implementing, Refining, and Improving an Integrated System. The people that we are privileged to be working with across the country are at many different stages in this work. As many of you today, you may think you're exploring, but you're probably going to find that there's some pieces of implementation or some things that you already have installed that coincide with this ISF structure. We have been busy. Just in 2015, we hosted, well, they were hosted by the National System of Care Technical Assistance Center. So we did 4 webinars in 2015 that were hosted through the System of Care TA Center out of the University of Maryland, and those are all available to you at midwestpbis.org. You can click on any of those links. And in 2016, we're only in the first week, so we actually started this in July of 2015 and are continuing it through 2016, is we have a group of sites around the country that we're referring to as a targeted work group. And the purpose of the targeted work group, who we have on webinars, we're about once a month since July, I believe. And these targeted work group webinars are a little more nitty-gritty on implementation and struggles. And the idea is for people doing this work to learn and interact with each other. And we're also trying to create learning examples to serve as national demonstrations for conferences, for papers, for technical assistance briefs. And so we're into documenting people's efforts and increasing capacity. And we do have a random control trial study that was just funded through Mark Weist's leadership at the University of South Carolina, where we're going to have an opportunity to do random control trial study of ISF, meaning PBIS with school mental health, PBIS without school mental health, and school mental health without PBIS, if you will, 3 groups. So some of the tools that you can have access to if you decide you wanted to join this targeted work group with a district that you're working with in California, you could become part of this group and have access to some of the tools that we're developing. So our target audience for the webinars and for our targeted work group are people like you all on the phone, people who are coordinating and leading PBIS, for example. And so Susan and I and Kelly refer to the people who are coming to our webinars as ISF facilitators, meaning they are, a lot of them are PBIS trainers and coordinators who want to incorporate the very deliberate work of integration of mental health into their PBIS implementation. We also have some ISF facilitators who join us from the agency, mental health agency side, who are also working with PBIS partners to do some of the tasks that are on the screen. Our national work group would like to support people like you who work directly with the districts and give you tools and support so that you can bring this work into your already established PBIS technical assistance work. For California, this is a big deal because California, as you all know, and I don't live in California, so I'll say this from my perspective, you all know that there has been a big push of mental health collaboration in schools for many years in California, and we are well aware of the fact that the funding structures have changed and new opportunities are available to school districts to provide leadership for mental health integration in schools. So we think it's very timely, and we've been working with Mike as our lead person with the PBIS Coalition to see if there's some sites in California who actually want to join our targeted work group. And you can see that we have sites that are part of the targeted work group, either in exploration, adoption, installation, or implementation from various states. And there's California over here listed as a potential because we've been in touch with several districts that want to do that, or several facilitators who want to do that. So we welcome California to the discussion. And just to give you a little bit of an idea of the workflow through the targeted work group, we're working with facilitators like yourselves to select districts who want to have an expanded district leadership team that includes community members that establish operating procedures, do some resource mapping, develop an evaluation plan, an integrated action plan, and we have examples of MOUs, memorandums of understanding, about how people will work together. So we're, again, into the nitty-gritty. If you're interested in viewing some of the targeted work group webinars, they're not posted publicly, but we share them with all of you as potential participants. So we put that in this slide for you as well. So that's a little bit of background on our national work to date and our invitation to all of our California pals to consider carrying this work through with some of your districts in California. So what is this work? What is the ISF work? I think that a little bit of context and upfront definition that I'm going to provide for you is not new information for most of you on the call, but it may be. So, you know, not knowing all who you are, but knowing who some of you are, I know that, for example, this slide, why do we need partnerships, is a bit of preaching to the choir. But we use this particular slide in our discussion of why we need an integrated system and why schools cannot even begin to meet the mental health needs of all their students without active partnerships from community providers. This is the mental health issues in our country are much bigger issues than schools alone can handle. And having separate systems has led to a lot of problems that are listed on the screen here. The other thing that has changed in the past year or two is the new focus on discipline and mental health coming together into one focus. So some of you might remember the new federal guidance that came out on school discipline, and the key message being that zero tolerance doesn't work. Everybody, like myself on this call, we said, seriously, of course we know zero tolerance doesn't work. But it sure was exciting to have Arnie Duncan and Eric Holder go public and make that clear to everybody that we have bigger issues to deal with. And we've resulted in a lot of inequities by having those zero tolerance policies. And you're probably all familiar with Now is the Time and all the grants that were funded from this. For example, you know, I didn't put in how many are in California because I couldn't remember, Mike, but I believe we have maybe 13 school climate grants in California, Mike?
I think we have 15 school climate, and I lost track of the Project Awares.
Exactly. So California is a big player here. So out of 71, you see my dash, that's 15 of them are in California. And this is just some of the work or the places where ISF work is being looked at in terms of helping move forward more integrated systems. So overall in our country, a more mainstream conversation about mental health. Some of you may have seen President Obama's speech on TV the other day where mental health and gun control are being discussed together. A year ago, mental health and school discipline was being discussed together. But mental health is certainly not an academic dialogue anymore. The awareness of the need to do more, the recognition that families and schools have critical roles, and the whole issue of prevention and early detection is important. The big bullet point on this screen for Susan and Kelly and I and others in our work group is, in the old world, mental health was considered successful if kids had access to services. We all know that access does not necessarily mean we're getting outcomes. We have lots of kids having contact with lots of mental health providers at school or in the community and who are not having improved quality of life. So the new discussion is we are not simply counting kids who have access, but we want to make sure that the interventions delivered have a match between the presenting problem and the likelihood of outcome, and that we just don't count referrals and service delivery, but we actually go for outcomes. So we have a lot more work to do, and the need for our interconnected system that we're all, it's kind of like world peace, we all know it's important and the right thing to do. The need for interconnected systems is to address some of the challenges. And Mark Weiss, one of our very important partners, talks about ad hoc and weak connections of community mental health providers to schools. Even when they're physically in the school, we're not having connected service delivery. So the need for systematic memorandums of understanding that clarify how practitioners need to work together at the school level, the need for the integration of community partners in teams at schools rather than having their own separate teams is a key feature of the interconnected system framework. And the idea of somebody needs to mute. The idea of funding people to work at all three tiers together. Somebody's speaking and not on mute, if you could help us out there. The funding support for partners to function together at tiers 1 and 2 versus only having mental health providers be responsive at tier 3 is a critical challenge. Yeah, we're having a lot of noise on the line, so we have a few people that are not muted and that are talking. Thank you. We also have some constraints on our personnel allocations. I've never met a school district that said we have all the school psych counselors and social workers that we need. We're far below recommendations. And also the status quo, very narrowed functioning of positions. For example, school psychs that are spending all their time evaluating, or counselors that are just simply gateways to advisement for people as opposed to actually participating in intervention systems, and social workers coming in as crisis management. And the pressures related to gatekeeping in terms of which discipline can do what. I don't know how it is in your system, but we have seen this to be a big problem across the country. So as we move forward with our interconnected system framework and how to bring these systems together, we like to step back and think of this as a process of implementation from what we've learned from Dean Fixon and Karen Blase and their colleagues. And I'm confident that you're all familiar with the stages of implementation. And we're trying to use this very closely in the design of our tools and our implementation process. So where are we right now? So again, preaching to the choir, you guys are pretty familiar with the fact that PBIS, we have documented implementation through the National Center in over 21,000 schools, and we're quite confident that the numbers are higher than that, but those are the numbers that are in the National Center database. And as you well know with PBIS, what makes it work is not simply the science of behavior. The behavioral practices in PBIS are not new. What's new is the decision-making framework and the systemic processes to guide the people inside the schools about how to select, how to implement, and how to constantly look at data and outcomes and make choices, and how people in schools are being held accountable for the practices they choose actually being evidence-based and putting in place the systems to support the implementation. Again, I'm confident that all of our PBIS partners on the call are familiar with this, but this is the context for the interconnected system framework. So the advantages of bringing in the community partners and the mental health providers through the multi-tiered system in schools is because we want more effective decision-making while we're improving climate and learning environment. We know about the changes in adult behavior, which is critical, and of course, reducing the punitive and improving the outcomes. For those of you who are not familiar with PBIS, we have some mental health partners on the phone, and you're not familiar with it, the experimental research is finally there, and this slide will help you if you want to pursue any of that. But one of the things we do have in our favor with this framework is that the research is showing impact. That's why all of you are working in this area of PBIS, is because we have evidence that it works. So that's a great foundation, but as big a PBIS supporter as we all are, we know more is needed. We know that schools are struggling with effective implementation of Tier 2 and Tier 3. We know that office discipline referrals, if they are used strictly as the measure of problem behavior, that we are not going to get to our kids with internalizing issues. And we know that there's data available in the community and mental health prevention data that's not making its way to the school table. So the key questions with our ISF system framework, two key questions here. Can we expand the effectiveness of what we're doing through our school-based continuum if we bring a broader group of providers to the table? If we bring in the Boys and Girls Club, the local mental health agency, and make them part of the multi-tiered system in the school, can we enhance the continuum with a greater array of evidence-based practices? Can we meet the needs of more students with greater effectiveness if we have an integrated system, one set of teams, one set of players looking at data, and nobody operating in isolation? So our interconnected system framework is about using the multi-tiered system of support in school to enhance mental health in school. Another way of saying that is installing mental health through the multi-tiered system in school, right? Using systems, using the data, and using the practices. So PBIS is about evidence-based interventions, behaviorally important outcomes for students, right? But it's a framework, it's a continuum. It's about academics, not just behavior, and a focus on all kids, including our internalizers, not just our externalizers. So the interconnected system framework is about bringing these together, right? So let's go through the core features, and I've alluded to several of them. The core features that are going to be measured through the fidelity tools that are being developed by our national research team. Number one is effective teams that include community mental health providers. What does this mean? This means that the people from the agencies that want to work through schools with mental health would actually sit on the Tier 1, the Tier 2, the Tier 3 systems teams in the building, review the data with the school personnel, and be part of the dialogue and part of the designing of the intervention. So instead of having mental health people meet in their teams and PBIS people meet in their teams, we create one, let's call it, behavioral health system in the entire school, and no providers are delivering any interventions that aren't monitored through the team system in the building. And so this team would use data and select interventions. And the idea would be that we could become a more comprehensive system. Another key feature is early access through use of comprehensive screening, which is a familiar one to all of you with response intervention. And no interventions would be delivered without a predetermined measurement for both fidelity and effectiveness. And all intervention delivery would be coached at both the systems and practice level. Now you might ask, well, how is this different? This would be different because in our more traditional systems, often community providers or mental health providers, even if they're school-based mental health providers, have separate systems. And we have not in special education in mental health, we do not have a strong history, although it's getting better, for selecting interventions based on data and for progress monitoring both fidelity and effectiveness. Some of you may be familiar with the history of some interventions through special education and mental health where we would use clinician feedback. So we'd say to the clinician, how's he doing in your group? Pretty good, I think he likes it. Well, let's keep him in it. And that would be the extent of the progress monitoring. In other words, a lot of clinicians were left on their own to determine what intervention to use and whether or not it was working. That would change in an integrated framework using a multi-tiered system approach where everything would go through teams and all interventions would be chosen based on evidence that that intervention has a high likelihood of producing an outcome. So ISF defined, we have a structure and process for education and mental health to interact in a most effective and efficient way, right? That's the team and the use of data. But a key feature is that stakeholders who have the authority to allocate resource, change roles, and function of staff have to be the ones in the lead. So the ISF model starts with a district/community team of administrators and leaders who commit to a shared mission and strategic targets of integration and reallocate how staff are trained and how staff work together so that there's one system inside the building. So what you're hearing is tiered prevention logic, process and problem-solving teams, use of data to pick interventions, and progress monitoring for both fidelity and impact. Now, we've used those with PBIS and gotten pretty solid outcomes nationally. So what we would like to do is expand the continuum of PBIS so that we are having the expertise of some community partners to expand the continuum, but we do that within the same system so that we don't have separate systems and separate teams operating in the building. Our system of care principles are very strong throughout the ISF framework, and that's what you see with the last bullet point on the screen here in terms of active voice and ownership, families, and students themselves. So quick summary of traditional versus ISF. In the traditional model, we have mental health counselors who get assigned kids to their caseload, and people just know that they're, air quotes, seeing the student, and there's only one set of people who, quote, do mental health, and often case management notes are used to determine effectiveness and outcomes. In the ISF model, we want the mental health providers to be on all the teams at all the levels and help make decisions and guide kids to different people for interventions. And the clinicians are contributing to the integrated plan in the building, and fidelity data and outcome data are important. This next picture is just a model, a picture that we like to use that shows the different systems teams, an example of how it will change with ISF. So, for example, we're talking about family and community partners on these teams being part of the conversation. And then the intervention continuum down here, the types of group interventions and the type of groups that are provided. This is usually where the change happens first. Although we've been seeing more schools expand their universal, but in our early starters, Tier 2, where trauma-informed interventions and interventions for kids with anxiety and other mental health problems that usually don't get addressed through schools, that's where we see that. So, one of the key questions is where do the specific mental health interventions fit in? And the answer is the standard MTSS, multi-tiered system of support answer that says that depends on the data of your school and community. What we want to encourage with the ISF model is a greater range of data being looked at and considered by the teams. And there's some examples up here. So if you're in an inner city, in a neighborhood with very high rates of incarceration of families and child welfare contacts, you may be doing trauma-informed interventions and instruction of coping behaviors related to kids who've experienced trauma at Tier 1. In another neighborhood, you may see that only at Tier 2. So I'm not sure what's going on with this slide, but multiple evidence-based interventions of varying intensity, training on the interventions, ensuring identification, monitoring, and intensity of interventions. So take a quick moment, all right? The question on the table in front of us is, in your schools that have mental health personnel working in the schools, how is the structure and process similar or different than what we are describing? So if you could just take a moment and reflect on that. Any thoughts to share in the chat box so others can see your thoughts, that would be appreciated. Kelly and Susan, anything to comment on at this point before we proceed?
I think folks need a couple more minutes.
Okay.
So Lucille, Jessica's asking about confidentiality.
What's the
Where there's-
question?
She says, what about confidentiality? So Jessica,
Okay.
can you say a little bit more about that?
Sure. Let me answer that while maybe she typed some more in there. This, I did system of care work long before PBIS and interagency collaboration, and this was always the first question. And the answer, and Kelly is also another one who can respond to this, but the answer is confidentiality is treated like it always is, okay? So on the systems teams, and I'll go back to that slide if I could for a moment, these teams do not talk about individual kids, okay? They talk about how many kids are in what interventions and what percentage of the kids are experiencing success. So if we have a bunch of kids that are not experiencing success at check in, check out, then the question is, what sorts of problems are they having and what other sorts of interventions do we need? Do we need to look at kids that also have low grades and low attendance and aren't attending? Then we would talk about something like check and connect or trauma-informed interventions or coping cat. So the issue here is you are not talking about individual kids. When we get into the problem-solving team where people do quick and simple brief FDA BIP, again, the families and the kids that we're talking about give the authority to share their information, and it's just their information for problem solving. On the Tier 3 interventions, each student has their own team, and the only information that's shared about the kids is within their own team. So I don't know if there's something else in there to respond to or if that's enough there.
This is Kelly, and so first of all, I just want to make sure that you can hear me. Mike said it looked like my audio was maybe not correct. Can you hear me?
I hear you. Yep, sure do.
Great. Okay. So a couple of people, Lucille, have commented that essentially what you described as the traditional way of doing things where mental health is essentially co-located in the school, but it's business as usual, is the more common experience. And the clarification around the confidentiality comment was, as the, let's say, community employed mental health therapist, how do you maintain confidentiality? And I'll just say, again, adding to what Lucille already shared, that we do not want this to be a barrier. And if, as a clinician, you are working with a child, their family already would be aware, consenting, and involved in that. And if you're collaborating with school partners, the family would also be at the table and involved in regards to all of the interventions that you're collaborating on. So there shouldn't be an issue of confidentiality because everyone would be on the same page with regard to the interventions that are in place and what it is that you're working on. There's also another comment from Jenny Ventura, who I think has been on some of our webinars.
Yeah. Hi, Jenny.
That as long as we've got the release of information and, all of the things that you typically do, it shouldn't be a barrier. I mean, both on the mental health side under HIPAA and on the school side under FERPA, we're all trying to do things in the best interest of our students.
The biggest problem we see with confidentiality is loose lips in the teacher's lounge, loose lips in the hallway, loose lips in the parking lot, and at the supermarket, where people are having the team casual conversations about people that they shouldn't be having. And that's the biggest complaint from families, is people are talking about them behind their back. So that is one of our biggest challenges, is for people to understand in a systems team, we are not talking about individual kids. And when we do talk about individual kids, is with their families, not talking about them behind the family's back. So that sort of shifting culture, it isn't a shift in culture for ISF, it's a continuing challenge in terms of getting people to use the system meetings appropriately and to only share student information when the family and the students are part of the process, which is the system of care principle. Kelly, I'm not seeing the chat box, so let me know if we should move on.
A couple of folks are still commenting, really good comments, and hopefully we'll be able to capture those, Mike. I know you're recording this, but it's good to see that there have been some folks trying to work around some of these potential barriers.
Okay. The slide that we have up here now is one of the critical features that comes up with the ISF, but quite frankly, we deal with this in Tier 2 and Tier 3 with PBIS, even when people do not have community partners at the table. But one of the changes for not only our school-based clinicians, but for our community-based clinicians is they're used to being the facilitators of the interventions, providing the direct support. And of course, clinicians continue to do that, but they also play a role on different tiers and in different different intervention groups where they're the coordinators of the interventions. So there's a whole webinar on the changing role of the clinician. And Allie Hearn, who works with us at former school social worker, talks about how a clinician can travel through the tiers. And this happens even more with the ISF model. And so when we talk about clinicians, we mean school and community-based clinicians. So whether it's a school psychologist, a school social worker, or a community therapist or a community clinician, in the Interconnected System Framework, we want those people to participate in different ways on the different tiers. And at Tier 2, we begin to see people actually facilitating interventions, and at Tier 3, we see people facilitating interventions. So that's a larger topic, and if you're interested more on the changing role of the clinician, there's lots of PowerPoints from the last PBIS forum, the Center for School Mental Health, we did presentations on it, and there's webinars on that. So we just wanted to end the discussion of the global core features with pointing out that coordinating interventions is just as important as delivering the interventions. What we're going to do now is do a quick shift, and I'm going to finish my part quickly and then turn it over to Kelly, and we're going to give some examples from the field. And these are going to be quick, and then Susan's going to walk us through some of the current resources and support in schools that we have. What I have on the screen in front of you is an example of a mission statement from a very large school district in northern Illinois, actually the second largest school district in Illinois. There'll be a prize Mike will provide to anybody who knows the largest school district in Illinois. But anyway, Elgin Unified School District 46 created a coalition they call the Community Alliance. And they put together a group of leaders from the top level in the school district and agencies that were willing to be part of a transformation into an integrated system of mental health in schools. And they came up with their mission statement that guides all their work, and I think they're on their, I don't know, Kelly, I'm going to say their fifth or sixth year of their Interconnected System Framework. And this looks like a really simple mission statement, but the idea is if you want to be part of the alliance in this school district, and by the way, this school district covers 4 different and distinct socioeconomically different and diverse communities. So lots of different agencies are at the table. And they've agreed that they want to be part of this with this mission. But you notice how they underlined based on data? I thought that was interesting, right? And they're talking about tiers, they're talking about systems, they're talking about data in their mission statement. Here's an example of some of the community partners. And every year they sponsor multiple trainings, and the way it works in this school district is if you want to be part of the Community Alliance with this mission statement, your agency personnel have to participate in one of the trainings where you learn what a multi-tiered system is, how we only select evidence-based practices, et cetera, et cetera. But you'll notice that this is not all mental health agencies. You'll notice on here Fox Valley Pregnancy Center, hospice, Girl Scouts of Northern Illinois. There's a Boys and Girls Club, the YMCA. Now, Streamwood Behavioral Health Care System is a local mental health center, and so are a few of the others on here. But, you know, the Elgin Police Department, I've been to the meetings, and they're there front and center, and they participate in the different work groups putting together intervention opportunities for the schools. And they have 53 schools in this particular district, and this was their current status, just about a year ago. So I haven't updated this, well, about 6 months ago. But they have community partners sitting on Tier 1 and Tier 2 teams as active members in all their schools. They don't have them all at all 3 tiers in all the schools, but all the schools have somebody on at least 1 tier. And they talk about the training and how the community partners come to PBIS trainings with school staff. They're working on the integration of restorative practices. They're working on Tier 3 Renew, different interventions, a more expanded screening. So they've been at it for a while, and their work is pretty deep at this point. But I wanted to share with you quickly one of the learnings from their first year that we thought was interesting. While they were developing their Memorandum of Understanding, the community providers were not allowed to deliver any interventions in the school. They didn't have a pre-existing school mental health system, so it's different than the California system. They were only allowed to sit on the teams and help the school people brainstorm how to do things differently following a PBIS model. But what was interesting in this one school is they got an impact pretty quickly, right away in that first school year, but nobody delivered any interventions other than school personnel until 2011 in this particular school. But they already had an impact even on their kids with 6 or more. In other words, having different viewpoints and broader viewpoints and committed people who view mental health differently at the table actually had an impact before they even started delivering the interventions. That was not expected. We're not exactly sure what it's all about, but we have heard from, we interviewed the school personnel, and they said having them at the table helped them come up with more strategies for delivering things that they were working on at Tier 1 in particular. An example of the difference between traditional and integrated with data. Traditional, no data to decide on or monitor interventions, and integrated, we're using data for all the interventions. In Elgin, the community mental health providers brought a new data point to the school. And this is a quick story, and then I'm going to turn it over to Kelly. But what they did was they were putting together a group at the high school for kids who were at high risk of dropping out, and they had all their data points, and they got all the kids, and they selected an intervention. And part of the intervention impact that was expected based on the research of this particular intervention of a group that the mental health providers brought to the table was that the kids needed to feel more connected to their school, and that was more of a proximal data point. The distal data point would be that they didn't drop out. But they decided to measure kids' perception of connectedness and feeling respected and important at school. And the reason is the mental health providers made it clear to the school people that ODRs, or daily progress reports, with high school kids with these risk factors was not enough. And they brought in and developed a survey that was research-based about kids who did drop out, not feeling connected and not feeling respected at school. And so they expanded the data view for the high school personnel. So I just wanted to share that quick example. And now I'm going to turn it over to Kelly, and she's going to give an example from Pennsylvania and then give you another opportunity to give feedback quickly after that. Kelly?
All right. And I just want to double check, are you going to advance the slides, Lucille, or are you going to give up the presenter to me?
Mike, I can just advance the slides if that might be smoothest.
Okay, that's fine.
Yep. We won't lose any more time that way, okay?
All right, sounds good. In Pennsylvania, with an organization called Community Care Behavioral Health, they are actually the behavioral health managed care organization for over half of the counties in the Commonwealth of Pennsylvania. They worked with stakeholders such as families and school partners and county collaborators, as well as mental health providers, to transform the way mental health services were delivered to kids and families through school systems. So this is just giving you information about the most recent statistics of where all they already had placed these community and school-based teams, which were responsible for all of the clinical interventions, case management, crisis intervention, but also a portion of their time could be spent collaborating with school partners and sitting on the Tier 1 system team for PBIS, Tier 2, and Tier 3. So it really moved beyond just that a clinician was located in the school building, but they were able to collaborate on the interventions and look at the data to progress monitor. In particular, prior to the installation of these teams, there was not the use of data to track fidelity of intervention for mental health or outcomes. So were kids and families actually doing better across life domains, so home, school, and community? And what we did in this project was worked with the school and mental health agencies to really have these outcomes collected on a regular basis and then use that data to inform the interventions that were in place. Here is some information from one of the surveys. It was called the Child Outcomes Survey, and it was actually developed with Community Care and their evaluation team at the time led by Brad Stein, who is now with RAND. And this survey is a 10-item rating that's completed by families while they're in a session with their therapist. And it looks at the family's perception of how their family is functioning as well as their child is functioning, and it can actually be done through a secure web portal. And then these graphs, which you see an example of here, which is an aggregate, but with just one family, would show the trends over time, and they could use that to inform the therapeutic interventions that were happening for the child and the family. I think, yeah, so here's one just for the child functioning. And again, you can see over time, and these were done once a month with each family, you know, that certainly kids and families' perceptions of functioning is improving over time. The other tool that was used is the Strength and Difficulties Questionnaire. I know there are some schools who use this as a universal screening tool. It's a 25-item rater, and it can be completed by teachers, parents, and there's also a youth version. It does look at multiple domains and includes internalizing and externalizing concerns. What you see here is one of the subsets, which is the total difficulty scale. And so in this case, you see improved outcomes if the bar is moving down, trending downward, because in this case it's showing you that both by parent report and teacher report, there are less difficulties that they're observing for the child. And these were completed for each student quarterly, so at baseline and then once a quarter thereafter. What we also did is we started to take a look at schools who were implementing PBIS with fidelity and had the CSPDH team, and they were working collaboratively in the Interconnected Systems Framework approach, and we compared it to other schools where they had the CSPDH mental health team and service, but they were not working under the auspices of ISF and may or may not have been implementing PBIS with fidelity. And what we saw when comparing those two groups was there was a greater improvement over time for both child and family functioning in the schools where we had ISF in place, and that's what the graphs are here that you're looking at. So the red bar represents children who were receiving services from the mental health team who were operating in schools where they had PBIS implemented with fidelity and the key concepts of Interconnected Systems Framework, versus the yellow bar, which is schools who had the mental health service but did not have PBIS in place and were not using the ISF framework. So improvement both, again, for child and family functioning.
And Kelly, if I could say, this was a really exciting finding, and the random control trial study that's beginning this month, 3-year study in schools in South Carolina and Florida, is going to take this and test it out further.
Okay, at this time, again, we want to open up the chat for any questions or thoughts about these examples, both from the school district in Illinois as well as the example from the school district in Pennsylvania.
Or any other thoughts and questions.
And this is Susan. Just to let you guys know, I've had several folks asking about copies of the PowerPoint. So we will share resources with you, the recording of the webinar, PowerPoint, and any other resources that you might be interested in.
Lucille, I'm not seeing any other comments or questions related to the content in the chat. And I see that it is almost 7. Might be up until 7:30. Is that correct?
Well,
Make sure that we...
I don't want to scare people.
I'm so sorry. I'm so sorry. That was very
4:30.
selfish of me. I'm on the East Coast. Yeah. We're keeping you all till 7:30. Yeah.
Yeah, we're going to transition, and Susan's going to share with people some of the resources and supports that we are using and developing through our targeted work group and our research team. Susan?
Okay, so if you can advance, Lucille, for us, one more. Knowing full well that you all are already kind of in the thick of this and working with school teams and working with district teams, we wanted to provide kind of a catalog of resources that are available for use. And we have a Word document that's up on the screen right now that, again, we'll make sure that you get access to. But because our resources are in different places, whether it be a website or within the monograph, we wanted to kind of catalog them to make it easier to identify all of the resources you have available to you and get quick access to them. So the way we've organized it is by the name of the tool that we have available, the level of implementation. So if you're working at the school level, you can see that the first one around a survey on readiness is really for the school team to kind of utilize. We also are organizing it around the purpose of the tool. We've got the authors or citation and considerations for use. So who might be using this readiness tool, and if you've got a team or you've got a school staff that might be interested in moving forward with connecting mental health and PBIS in a more rigorous fashion, you want to get key players that are involved. And then the access for use is, this particular one is accessed in the monograph. So you can see how, in the next couple of slides, how we've kind of cataloged all of those. And I'm going to quickly go into a little bit more detail on a couple of these tools because I think we're most excited about them. One is the ISF Action Planning Companion Guide to the new school-wide PBIS tiered fidelity inventory. And you all are already using that in California, have already had training on the tiered fidelity inventory. We're really excited about this new tool. But one of the things that Kelly, Lucille, and I and our team have developed is really a companion guide so that you can strengthen your ISF components. We're not using this particular tool as, it's not used for scoring the TFI, but rather as an action planning process for your integrated team to use to really kind of reflect on, well, what are the ways that we can enhance current implementation to include some of those ISF core components. So you can see under the subscale of teams, we've got, and again, you all are familiar with the way that we have set up the new fidelity tool for school-wide PBIS. The first item is under team composition with this big idea for PBIS that effective PBIS teams are knowledgeable, they're representative really of our stakeholders and have the administrative authority to be able to deliver some of the things that we want to be able to deliver. So you've got that status and visibility. With ISF, we really want to make sure that our community partners are familiar with the operations of the school and work together with the educators to promote more healthy social-emotional functioning for all students. So this idea that we really want this to be not only our staff within our school, but really who are the community partners that can also serve on this team. And we want to make sure that we're including families and students as active leaders and participants in this process. So we really have drilled with this companion guide, we really drilled down to the essential core components within each of the TFI items that really give you an idea of going into maybe a deeper level of utilizing PBIS. You can see this other example around implementation. This one is around those behavioral expectations. So we're all familiar with this notion that we all need to have brief, memorable, positively stated expectations that create that school-wide culture and that common language. But then with ISF, how do we really take that teaching matrix and really foster this notion that we want to have skill-building opportunities, promote these positive relationships from peer-to-peer and staff-to-peer, and sometimes staff-to-staff, and really focus on the social-emotional competencies of the entire school community. And then we drill down even further into really specific ways we can enhance implementation with making sure families and students and our communities are participating in the development of the expectations. They really have a say-so in the language that we've used. So this companion guide goes through all of the TFI items, and it really gives you a very deep understanding of what we mean by ISF enhancement to the PBIS implementation that's currently done. We're seeing a lot of our PBIS schools have been doing this for a while, take this companion guide and strengthen their PBIS efforts. So it's been an exciting kind of first round of being able to use this with our school teams. All right, Lucille, do you want to? The next one we wanted to go into in a little bit more detail was this consumer guide. Again, at the school level, we're really worried about having our mental health partners join our teams and expanding the use of evidence-based practices, but we really want our teams to be better consumers of the evidence-based practices that are out there. Meaning, just because it has evidence doesn't necessarily mean that you need it, and more doesn't mean better. That we really have to have a selection process, a formal selection process by which we say, is this needed? Does it fit our context? What barriers to implementation? What are the systems features that need to be in place? And so, Lucille, can you forward just a couple to the next one just to give, so this tool goes through a really a nice kind of process that teams can go through to make sure that they are considering the developmental level of the students and youth that they're serving, the expertise of the provider that's needed, making sure it's culturally appropriate. And so it's, again, a really nice guiding document for teams as they're selecting EBPs and making sure that the systems are ready to receive the EBP and that we've got the right skills at the table to be able to do it with fidelity. So again, just want to highlight another tool that we're kind of geeking out about right now.
And Susan, we don't have more on the slides on that tool, but if you guys look up that tool, it's right in the monograph. It's been out for a while. Bob Putnam created some wonderful examples of a good example and a non-example of how a school should choose an intervention based on data. And Susan, as Susan said, it's a really simple tool, and any school team, you don't have to be doing interconnected system framework to use it.
No, you don't. You don't. And again, this is a really big push to being better consumers of evidence-based practices out there, and this notion of streamlining what it is we're asking our staff to participate in and making sure that it's got the right match. And I'll, again, make sure that we not only send the PowerPoint to the group, but also the tools at a glance document so you can get quick access to the tools. We'll give you the consumer guide, and we'll also give you the action planning companion guide as separate Word documents so you don't have to go searching for those. In terms of some of the validation the tools that we're using for our validation study, we want to take a moment to talk about, you know, we've been in development for a while here with some of our ISF tools, and it's really exciting opportunity to get a little bit of grant support for a validation study. So our partners under the leadership of Mark Wiest we're in the recruitment process of identifying schools that are interested in participating. And we really are interested in establishing the psychometrics, the feasibility and acceptability of these measures. So some of the benefits are evaluating your current practice and developing action plans for ISF implementation and having some support from Mark's group in order to make that happen. So right now we are in the process of looking at 2 different tools. One is the readiness tool, and I don't know if that's on the next slide, Lucille. And oh, it's right there. And then the next, so the ISF readiness measure survey is one of the tools that we are going to be looking at to get some validation measures around. And then the second one is the implementation inventory. So with the readiness inventory, again, this was something, I'm switching back and forth on you, Lucille, I'm sorry.
All right, you want readiness now, Susan, you got it.
Yes, sorry. I see my screen flipping back and forth. So with the readiness survey, this is used by school and community leaders. So it's that team that's getting started with your mental health partners and your PBIS Systems teams. And this survey will allow you to kind of go through step by step to understand all of the perceptions involved, the feasibility in kind of implementing any big changes in your school, and the types of available resources that you might need. So if you're considering kind of moving forward with some of the enhancements, that would be a great place to start. Or if you're a school that's already doing some of the ISF elements and you want to check for fidelity, the implementation inventory will get you into that much more detailed analysis of the ISF implementation effort. So if you're interested in participating in these validation studies, again, you'd be beta testing, you give us feedback on the items. We really are in the recruitment process, so if you are interested, please notify Joni Splett by email, and Joni will send you out links to access the surveys. And we're hoping to be, the recruitment process to be completed by early January, but my understanding is that we're accepting schools pretty much throughout the school year, even though we've got some dates on here that look like they're sooner rather than later. But again, these are for schools that either are ready to jump into the ISF process or already kind of in it.
And a comment I'll make about the tools is those of you that are PBISers, which I think at least 90% of you on this webinar are, you'll be pleased to see that the development of these tools drew a lot from the structure and process of a lot of the PBIS tools in terms of simplicity, but more importantly, leading to action planning. And so if you do decide to participate in the study, it's an online Qualtrics system, and there will be, report cards and feedback given so that the schools will be able to use the information for action planning. So again, the MTSS influence. And Susan, you wanted to share, we also wanted to let them know that we have TOT materials in development and have been working with some states on that.
Yeah, so we have developed, again, as Lucille mentioned earlier, we are considering folks that are on this call to be the ISF facilitators. And so we have developed some TOT material for ISF facilitators so that they can become much more fluent with the ISF core components and have tools. So we're spending a lot of time on that tool section going through the resources that you have, but we are also really interested in getting more participants who can give us many more examples than what we currently have. So we've got a lot of material that's in development, so if you're interested in looking at that, we can certainly share those materials with you. again, they are in process, and we look forward to hearing feedback on that. Some of the material includes ISF overview. We've got information with respect to district community level implementation. We have a guide. We have a module on multi-tiered screening. We also have a module that's specific to installing an evidence-based practice like trauma-informed care and restorative practices. And then we have a module that's, that goes into a lot more depth and detail around the action plan and companion guide that I was just describing. So we have isolated independent modules, and we've got, as Lucille mentioned originally, we've got a lot of upcoming opportunities for not only the targeted work group, but also some conferences in San Francisco at APBS. I think Kelly and Lucille, you guys are doing a half-day workshop on the day prior to the conference on that Wednesday. And then we've got the Center for School Mental Health will be in San Diego in September, and we have a huge array of ISF workshops, and we seem to be taking over that conference a little bit. And then we've got a whole strand of mental health during our PBIS Leadership Forum in October of this year.
Right, the half-day forum, half-day workshop pre-conference to APBS in San Francisco is a great opportunity for the California partners. So if there are key leaders in some districts and communities that you would like them to hear about, you know, more than a 75-minute webinar, it's about 3 hours and a lot of dialogue. We usually get a very diverse group of people in for this pre-conference workshop. Just seemed like a great opportunity coming up soon in your own state.
Thank you, Lisa. I'll make sure people get a flyer notice for that specific opportunity.
Yeah, and the other side of that, Mike and everybody on the call, is it's a small venue in San Francisco, and if you're going to go, get your, they're even going to cut off registration because of fire code in the building, and you know, they expect to sell out. Susan, how's that registration going? Have you heard?
Yeah, it's we're selling out in record numbers. So the sooner, you know, if you can make plans sooner than later and go ahead and register, all the better.
Yep. So, okay, so we've reached the end of our webinar content, but I want to direct back to Susan and Kelly in terms of anything coming up in the chat room in terms of questions or comments or.
No, there has not been.
Okay, Mike, then back to you.
Okay, thank you, and thank everybody for joining us. I really appreciate Lucille, Susan, and Kelly spending your time to help support the folks in California. And we'll send out all the flyers to people. I'll make the webinar available probably later this evening. And I think that's it. So have a great evening, everybody.